Dr. Commiskey in Albuquerque, New Mexico. This is a patient with a complicated medical condition who has bilateral brunescent cataracts. It's actually surprisingly good red reflex, but you'll see the cataract is quite dense. Bag is a little bit loose as well, so make sure it's fully mobilized. You know, com bilateral cataract surgery is an interesting idea. It's something that many papers have demonstrated to be very safe. My favorite one is that the risk of having a bilateral endophthalmitis, serious infection inside the eye, is less than the risk of having a fatal car accident from driving to the additional visits and post-op visits and so forth uh, to have the two eyes done separately. The risk is quite low either way, but yeah, something that we were able to offer for some patients for a while, and then the insurance plan that was doing that doesn't allow that anymore. So anyway, some patients get kind of a special medical dispensation here at the hospital setting for us to do little surgeries just because they're medically complicated. The risk of anesthesia is too great, and so forth. So this is one such patient where we're able to do both eyes in the same day. Usually we also kind of think twice about doing brunescent cataracts on the same day, right? Because you're kind of expecting some corneal edema the next day. But that was all part of the conversation with the patient and the risks and benefits of doing things this way. So you can just see this is just cataract surgery. I love chopping things up into little pieces and uh, feel that that helps make the corneas clear the next day. So I'm just gonna let the video play. Don't have a whole heck of a lot to say about what we're seeing here. This is the Alcon preloaded lens, CCAOTO. I believe our target was -1, which is a nice target. That's roughly arm's length, tip of the fingers. Um, and for patients that have uh, hard time with things, that gives you pretty decent vision. I mean, you're almost legal to drive if you're -1. And then you can also read a fair amount up close. You're not reading fine print, but so the target of -1 actually gives you quite a bit of range. I actually went for a period of time without updating my eyeglass prescription, and I had become minus 0.75 more myopic from my previous eyeglass prescription, which was like 5 or 6 years old, and I didn't even realize it. I mean, honestly, my quality of vision was still quite sharp, but things at the distance, far, far distance, were not as sharp as they used to be. Um, well, that all changed with the new pair of glasses, but it just goes to show you how adaptable our minds are to a little bit of nearsighted refractive error, which is actually, quite useful. So yeah, target of -1 for this patient who has, a lot of medical issues and was kind of favorable for. We even have ophthalmologists in our practice who have, elected to be -1 in one eye, -2 in the other. That's a pretty good prescription. That means you can kind of see the computer, you can kind of read up close, and you don't need glasses. And then stuff at the end of the hall you can certainly make out, but if you're going to drive a car, you wear a pair of glasses. But most other things you can do without glasses. So there's interesting options other than just having both eyes set for distance and wearing reading glasses for up close. And so it can be kind of fun or rewarding to kind of parse that out with patients when they come to see us in clinic and kind of figure out exactly what type of refractive error or eyeglass prescription that they would want to have afterward. In the video here, I just recoded the endothelium with more visco to protect it from the CDE or phaco energy. I think the CDE for the first case was 19, and for the second case it was like 25. So not terrible, but certainly quite dense. So we're coming up to the end of the case here, just taking out the cortical material, and then after this we'll, uh, put in our lens. Same lens, manufacturer for this second case, the Alcon Clarion platform, which they have come out with in the next, year or two, or sometime in the last year or two. And nice little delivery system there. There we go. So lens in the bag. Here we go. Both eyes. Fresh new look on life. Hopefully this patient enjoys it and contributes to their quality of life. Thanks for watching.